I'm Bruno Paiva from the University of Navarra in Pamplona, Spain. At ASH, we presented for the first time a new flow cytometry method that we named as Bloodflow, empowered with greater sensitivity, with the aim of detecting MRD in the peripheral blood of patients with multiple myeloma. I believe that everyone agrees that detecting MRD in blood is an unmet need in myeloma, and therefore we made significant efforts towards improving the sensitivity of next-generation flow. Next-generation flow already by itself can detect MRD in blood, and it is prognostic in blood, and in fact we showed this at ASH. However, whenever, I would say using either NGF or NGS, you are unable to detect MRD in blood, and there is persistence MRD in the marrow. This is associated with inferior progression-free survival, and we also showed this data at ASH. This is why I believe there was clearly need to improve the sensitivity of these methods for a more robust MRD assessment and prognostication in blood. This new method, Bloodflow, is actually very simple. It just combines immunomagnetic enrichment of circulating plasma cells from large volumes of peripheral blood, using, for example, CD138 beads, as we have been using for decades for fish cytogenetics, and then we do NGF on a small aliquot of circulating plasma cells. We've shown that by using this combined approach, it is possible to detect MRD systematically in the 10 to the -7 logarithmic range, and even in some patients and some samples, those with a higher cell count, it is possible to detect MRD down to 10 to the -8. And I believe this is unprecedented sensitivity for a flow cytometry method. We showed that by increasing the sensitivity, there is a greater capacity of detecting MRD when compared to NGF. We are also increasing the negative predictive value when compared to bone marrow MRD. The positive predictive value is nearly 100%, and preliminary results in a small series of patients with a new method is suggesting clear prognostic value. Therefore, I'm confident that with additional data from ongoing studies, it will be possible in a near future to offer minimally invasive MRD assessment in blood, perhaps not at the beginning of treatment, more at late stages of treatment, for example, during maintenance or observation if treatment is not until disease progression, and particularly with a combination of two techniques, possibly blood flow as well as mass spectrometry that continues to show very promising results, as shown also at ASH by the Spanish myeloma group, as well as many other groups spread around the world.